First of all, I just want to say rest in peace to Alex Trebec. I got the notification a couple hours ago. My condolences to his family and friends and anybody that may have been affected by this. I remember earlier this year, he gave us kind of a 1-year update on his cancer and said that his tumor markers were trending down. He felt great. And I was really curious at that point to know what cancer treatment that he was on, because I know how aggressive pancreatic cancer could be, especially the fact that it was stage 4. And I really hoped that at that point that scientists, were coming out with new medications that were targeting new things. So today when I got that notification, it kind of like pushed me to do a little bit of some research to see if I could find some information regarding this. And I was able to find something, so that's what I'll be sharing with you guys today. So this will be a very quick video. A little bit about stage 4 pancreatic cancer. So over 50% of pancreatic cancers are diagnosed at stage 4. And at this point, the cancer has already spread, with the liver and lung being one of the most common places that it goes. And here are some complications that we tend to see in pancreatic cancer in general. But of course, once you get to stage 4, these patients are more likely to experience these complications. And the average patient will live for about 1 year after diagnosis, unfortunately. So this is a very general treatment approach of pancreatic cancer. So I divided it into 2. So the first part on the left, so this is resectable and borderline resectable disease, meaning that you can actually do some kind of surgery on this, right? You could go in, remove the tumor. So surgery to remove tumor, sometimes we give chemotherapy after the surgery. And if the tumor is too big, you could give radiation plus chemo to shrink the tumor, do the surgery, and then more chemotherapy after that. For unresectable or stage 4 disease, usually the patient may get chemotherapy, radiation, chemotherapy alone, targeted agents. Clinical trial is recommended for any patient with stage 4 pancreatic cancer, just because there's not a lot of options for these patients or best supportive care. Now, Alex Trebec and Reid. Harry Reid was the former senator of Nevada. He was diagnosed in 2018. For him, I'm not sure if it was stage 4 pancreatic cancer, but fortunately he's still alive. Alex Trebec was diagnosed last year with stage 4 pancreatic cancer, and unfortunately we found out today that he passed. Now, both of these people received the same treatment as recommended by Dr. Soon-shiong, who is a transplant surgeon. He's also a bioscientist, and he's the inventor of Abraxane, a medication that we use a lot in pancreatic cancer, lung cancer, and other type of malignancies. Now, this treatment is termed the triangle offense, and it was given in combination with the standard of care. So here's a picture of him, Dr. Patrick Soon-shiong. The triangle offense, so this consisted of 3 medications. So one being aldoxorubicin. Then we have on the bottom left, we have the PD-L1 T-Hank, and on the bottom right we have the N-803. Now, the aldoxorubicin sounds very similar to doxorubicin, right? So this is the prodrug of doxorubicin, and it binds to albumin, in this case after administration, to facilitate the delivery to the tumor, to reduce the toxicity and improve the ability for the medication to reach the tumor site. And then we have the PD-L1 T-Hank, and this targets natural killer cells. For those of you who are not too familiar with PD-L1 inhibitors, these are immunotherapy, meaning that they use your own immune system to fight the cancer. And then we have another agent here, N-803, which I'm not too familiar with, but is known as an interleukin-15 superagonist, and this is also a form of immunotherapy. Now, please keep in mind that this regimen is undergoing phase 2 clinical trial for locally advanced metastatic pancreatic cancer for the first and second line. So, the takeaway message for this is that, immunotherapy will continue to expand in the oncology clinical practice. There are more immunotherapies that will come out targeting new things, new proteins. And this is very important, right? Because a lot of patients usually suffer from side effects of the chemo than the cancer itself. So having, these agents that are more tolerable to prolong survival and progression is very crucial. Thank you for watching this video. Make sure to connect with me on these social media platforms and take care.